Member for Ballina.
Thank you, Mr Speaker. My question is to the Minister for Health. Minister, my paramedics tell me that upwards of 50% of all call-outs for ambulance in the Ballina electorate are for non-life-threatening transfers between hospitals that can take them out of action for many hours due to distance and ramp times. Will you explore developing the patient transport system for regional areas like mine to operate at night and on weekends to support our paramedics to focus on responding to life-threatening conditions that require emergency transport?
Great idea.
Minister.
Fantastic question. Mr Speaker, thank you, and I thank the member for her question. She was an active member during that landmark inquiry into regional, rural and remote healthcare services and was a very, very strong advocate for her community. Patient transport, Mr Speaker, for those who are aware, is managed by part of the system called HealthShare. It plays an important role, and I'll get to particularly a particular population group in a minute, but it plays an important role to move patients around the system, obviously non-life-threatening, don't require a paramedic. Where that is challenged and where that is not as robust as it could be is, to be honest, where it needs to be even more, and that is in regional, rural and remote areas. Because if we don't get it right, then a large number of paramedics, as the member for Ballina alluded to, find they're spending a lot of time transporting patients who could otherwise be transported by a more suitable arrangement. So we are looking at this, and I will engage you with the Regional Health Division to work and continue to look at this. We are actually, under the leadership of Luke Sloan, looking at the policy with a particular focus on how it can be improved, particularly for those living in regional, rural and remote areas. And those of us who live outside metropolitan Sydney will be very pleased that we are focusing on that. Now that comes because of a deliberate focus, Mr Speaker, by our government on regional, rural and remote healthcare. That is very, very near and dear to my heart, but I understand it's very, very important to many people in this place. And many people across the political divide have been very strong advocates for their community. Mr Speaker, we're actually trialling a new model, a reservation-based model for patient transport in the Hunter, New England area.
Yep, thank you.
The early stages, the early advice coming back to me is that it is starting to work better. It means people have an understanding of when they're going to get picked up. There's better coordination and convenience for people. People are not waiting large and extended periods of time. So we'll have a look at what we can do to roll that out, but make sure that you are and your community and your stakeholders are directly plugged into that review process that we are doing. We're also rolling out, as I said earlier, 500 additional paramedics. First 125 have been rolled out. That'll be for Ballina and for that area. I think it's around about, it'll bring up your FTE to around about 25 paramedics.
Member for Ballina.